Hi, everybody. Welcome. My name is Sofia Gruskin, and I direct the USC Institute on Inequalities in Global Health. And I have to say, it's my great pleasure to welcome you all to, quote, building sustainable partnerships for climate resilience and health equity. This is our first event of the academic semester, and I'm really grateful for the degree of interest we have in this timely and important topic. We have a very packed schedule for today's event, so I'm just going to say a few words before turning it over to the wonderful Laura to moderate this discussion. So the thing is, all of us know, or we wouldn't be on this Zoom, the impacts that climate change has been having, reversing key health gains of the past few decades, but also thinking about climate denialism and growing political instability and the rise in authoritarianism and nationalism. And I mean that not only in this country, but around the world. I mean, every day we're seeing the ways in which climate is profoundly and negatively affecting health and well-being, and the ways in which climate is actually exacerbating pre-existing health inequalities and heightening the risk of infectious disease, of mental health issues, but also, I guess, importantly to say, the access and use of health services by folks who are already marginalized or at heightened risk of discrimination. At the Institute on Inequalities in Global Health, we have designated climate and sustainability as a key strategic focus area for our research, our policy, and our education work over the next 5 years, precisely because of these unfortunate realities and the need we feel to be part of determining how best to address them. So today's event is a reflection of this commitment, and I'm very grateful to our partners and the folks on this Zoom for engaging with us in this key area. I'd like to now pass it over to the fabulous Professor Laura Ferguson, who is our Director of Research at the Institute, and Laura will be moderating this panel. And Laura, it is with you.
Fantastic. Thank you, Sophia. Good morning, good afternoon, good evening, everybody, and thank you for being with us. I have the distinct pleasure of moderating this wonderful event today. And for those of you who are regular participants at our events, you may remember we're exploring the theme of partnerships at the moment, recognizing the diverse strengths that different stakeholders bring to an issue and the importance of how partnerships are structured to leverage respective strengths in ways that can be equitable and sustainable. And today we're applying this lens to the topic of climate resilience and health equity. And we have a fabulous group of speakers. I'm going to do a very brief introduction to each of them, and then we'll jump straight in. I won't do any of them justice, for which I apologize. Their full bios are available online. I hope you had a chance to read them when you registered for the event. In no particular order, we have Johanna Gonçalves Martin, who is a medical doctor, epidemiologist, and social anthropologist from Venezuela. And she's worked for over 20 years with indigenous peoples in the Venezuelan and Colombian Amazon at the intersection between biomedical and indigenous Amazonian care practices. Our second panelist is Hamza Sawa, who is the global head of social impact and innovation at Reckitt, where he leads the company's global access fund that invests to promote universal access to health and hygiene around the world. Hamza is a top 100 change leader, a One Young World ambassador, and a global fellow with the League of Entrepreneurs. Litiana Lagibalavu is a Fijian feminist and climate justice advocate, serving as co-focal point for gender and human rights with the Alliance for Future Generations, Fiji. And with a background in commerce and law and experience across intergenerational and grassroots advocacy, she works to advance rights-based climate resilient leadership across Fiji and the Pacific. Our final panelist, who's having a few technical issues right now, but we're working to solve them, is Rob McLean, who is a senior program specialist in global health at Canada's International Development Research Centre, IDRC, where he leads their flagship research program in climate and health, which is advancing research for climate and health. And he's worked across public, private, NGO, and academic sectors for more than 20 years, seeking to understand how human creativity can inspire and build a better world. So I told you they're all great. So let's get started. And I would ask, please put any questions that you have for the panelists in the Q&A, and I will do my best to get to them as we go along. But for now, I would like to start with a question for all of you, my panelists, because you represent very different kinds of institutions. And so together, there's a collective wisdom of those who are engaged in myriad types of global health partnerships connected to climate change and climate adaptation. So, to start us off and kind of orient the conversation, could you each say something about the work your organization does in the climate and sustainability space, and in particular, how your organization engages in international collaborations and partnerships? And ideally, if you could provide an example of a partnership that you've been involved with that you consider successful, and really why, from your perspective, it was so successful. And if I could start with you, Hamza, that would be great.
Well, thanks so much, Lauren, and real pleasure to be here. Um, so, I guess a little bit of context. So, Reckitt is, as you mentioned, it's a consumer goods company. It's a leading player in the health and hygiene space. So, with the purpose to create a cleaner and healthier world. So, people might not recognize the company, but the brands such as Lysol, Mucinex, Durex, some health and hygiene brands which are in many households across the globe. I think what's really clear about the approach really is that you can't really live that purpose to create a cleaner and healthier world when 1 in 4 people still lack access to safe water, 1 in 2 still lack access to basic healthcare, and we know that climate crisis continues to accelerate these access gaps and continues to widen divisions and intensify displacement. So I think during COVID, I think what we were able to formalize was the Global Access Fund. So essentially what this does, the fund has a mission to invest in universal access to health and hygiene across countries where we live, where we work, and when we operate. And the goal really is to see health and hygiene access as a universal human right and not a privilege. So a lot of the work that we do and collaborations that we run, partnerships, really stem from various areas across the business. So across our value chain, so how we think about sourcing our raw materials and being respectful of the natural environment and natural world. Um, how we think about manufacturing in our sites, and of course, doing less harm as possible as a consumer goods company when it comes to chemicals, water, plastics, and our materiality on the natural world. But then also, how do we really show up in communities where our consumers live and work and when we operate, and often where we see some of those access gaps which are heightened. So really, my role is essentially looking at how can we create partnerships at that climate, health, kind of hygiene nexus, water nexus, to advance equity while creating broader societal value and for the organization. So to give you an example, um, of one of the partnerships, as you mentioned. So, a partnership we've been running for many years, the past 5 years, is called the Reckitt Catalyst. And really, what this is about is looking at how can we move away from the age of isolated kind of corporate philanthropy and move it into an age of corporate innovation. So this is a £10 million social innovation hub that has a mission to support 200 innovators around the world at the nexus of climate, health, and water. So today we've supported, well, the focus is really to support women and underrepresented founders across the globe. So we know that 2% of the only goes to women. So the goal of the catalyst is to reverse that trend and invest in these founders. So we provide access to finance, mentorship, core business. So through this model, we've really lent into local wisdom, local insight, local know-how, and been able to scale their solutions. So we worked with about 80 founders in about 15 countries, unlocking access for about 1.8 million people. And I think what's been successful, the reason I guess we deem it successful is that we've been able to see some of those health outcomes improve, both from a breadth and depth perspective. We're able to see local solutions thrive and flourish and grow. And then ultimately, we've been able to bring the best of the private sector to those partnerships. So whether that's our efficiency, our rigor, and all those things. So that would be the example I would share. Thanks.
Fantastic, Hamza. Thanks so much. Let me move on. Litiana, could I ask you to jump in next?
Absolutely. Thank you, Laura. I guess to begin, I just wish to reiterate that we are living in a time of ecocide and we are confronting a triple planetary crisis of climate change, biodiversity loss, and pollution. Um, these interconnected emergencies threaten not only human health, but collective well-being and the very survival of our planet's ecosystems. Through our community outreach, owners and farmers consistently speak to the disruption of once reliable weather patterns. Crops are failing, soil fertility is declining, and livelihoods are increasingly at risk. These are not abstract impacts for us, they are forms of loss and damage that we experience daily in small island developing states, and these undermine our food sovereignty and food security. In the Pacific, we once lived by our traditional ecological calendars, guided by ancestral knowledge and seasonal rhythms. Climate change has forced painful adaptations, compelling communities to abandon these systems and respond instead to unpredictable and colonial induced climate realities that now determine what and when we can plant. As you had mentioned earlier, I represent Alliance for Future Generations Fiji, a youth led movement working at the intersection of climate, oceans, gender and human rights, and health. We build capacity in villages, we lift youth voices into policy spaces, and design community led adaptation that is culturally grounded. A clear example, I think, that I could share from a recent international partnership that worked well for us was our environment and sustainability program with Think Pacific. This was done in several villages around Fiji, and over the weeks that we ran this and over the weeks that we did this program, we ran co-designed workshops where Think Pacific youth volunteers from England and Wales, together with AFG facilitators, we trained local youths on climate science, on DRR, gender and advocacy. The process involved translating very technical material into local vernacular, which led to hazard maps and a youth written DRR plan. And these created lasting youth clubs and partnerships. I think the success with this came from the collaborative approach and co-design, where youths themselves in the villages set the priorities. The elders in the village, sorry about the dogs, the elders in the villages validated the protocols, and international volunteers supported, not led. So local ownership remained central. Um, Another strong hands-on success was with our Novel Lao project, where AFG supported local youths in vetiver planting to stabilize the shorelines. And we also supplied netting to rebuild their greenhouses for food security and ran gender and human rights trainings in the villages. And this strengthened community decision making. And it was practical because long-term resilience projects, we feel, need to be tied to local leadership. And that's what we believe makes it successful. We at AFG are also a part of a wider social, feminist, and decolonial movement where we are unlearning colonial systems of extraction and control. So the Navolao project was also an example of how we are relearning and re-indigenizing our relationship to land, to our oceans, our wetlands, our totems, our food systems, our futures. Um, and yeah, and just circling back, that defending this is not symbolic for us. It's essential to our very survival and self-determination.
Thank you, Luciana, and great to bring it back to the fact that this is about people's lives and this is very real. There's nothing abstract about what we're talking about here. Johanna, can I turn to you, please, next?
Yeah, sure. Well, I'm in a perhaps different position as a researcher. I'm more of a nomadic researcher. I've been in different universities, both in Europe and in Latin America, where I began my training as a medical doctor, and then I went to anthropology. So So my institution is difficult to define, right? It changes a lot. But throughout the time that I've been working with indigenous peoples, I could say that there's a partnership that outlasts the time of projects and research placements, that is like working with different indigenous organizations and people, specific people that become your friends and allies throughout time. So I would say that's more of my institution. And yeah, I think it's interesting because when I started in the 2000s as a recently graduated medical doctor working in the Amazon in Venezuela, it was difficult to find that nexus between health and climate. So if you're working as a medical doctor, there's little you have to do with climate, environment, planting, or anything else. And I've been also part of different NGOs that work with indigenous peoples, and where I was with them, it was difficult to bring anything of the health part because they were working on climate change or indigenous territories and so on. So there was a big divide, but it was evident from even in my health work as a rural medical doctor in the Yanomami territory on the border between Brazil and Venezuela, that things like illegal gold mining were as much of an important health problem for people as, I don't know, coughing and diarrhea and other diseases, that they were totally linked. And the Yanomami used to say that illegal gold mining is also a disease. So that led me early on to think about these connections between climate and health in a time in which I think there was a lot less on that. Um, More recently, and partly because of the situation in Venezuela, as you all know, I'm now live and work in Colombia, and that's also part of what I find important in my path. It's not just being at a university and traveling to a place and spending a little time there. I live in the Amazon, and the people with whom we work now are our neighbors. We share the pandemic. We share all the things that happen in the city, in an Amazonian city like Leticia in the south of Colombia. And we try to think together of how to deal with the things that are happening. So let's say the latest example is was actually an IDRC project, funded project that was looking at the response to the pandemic with indigenous peoples. And I think what was interesting about that project was first that we all lived the disastrous response of the pandemic in a place like the Amazon in Colombia and Leticia. And we all had a lot of things to share of how non-indigenous and indigenous peoples reacted to that. And and we, I mean, me and the team with whom I worked of non-indigenous peoples and indigenous peoples, I think we managed to think together of the ways what was really important of the response by indigenous peoples. Not just, I mean, it's often easy to romanticize indigenous peoples' approaches to let's say spirituality, health, and so on. But this was really practical, like a way of living in the world that actually made sense and helped them go through the pandemic and help them after the pandemic as well. So we had different spaces in which throughout with indigenous elders, with women, with young people, speaking of how they dealt with the pandemic, and also trying to put a language to turn that experience into a learning that is now helpful for something that is happening in Colombia and that is really exciting. And I will probably be able to speak about that later on. That is the implementation of an indigenous health system and from their own cultural, cosmological perspective, together with an environmental health system, environmental system and educational system. So it's a tripartite network system that allows them to really put forward within the legal system in Colombia their own ways of handling health, environment, and their education. So we did through the project what we found out through the pandemic. We managed with a lot of conversations and trainings and interactions between the elders and our group to put that experience into a language that is now helping them define their own ways of doing health and environment protection. So I think that was the latest, let's say the latest engagement that just finished, but we keep working on it in different ways, and that has really transformed the language from the Amazon in a national Colombian activism, indigenous activism space that is trying to gain that autonomy, that cultural autonomy to define their own health and environment and their own future. So I think that was really important. It's perhaps unique in Latin America, although Latin America has different examples of intercultural health. This is really driving towards autonomy. And I think that the way in which we manage to connect to people as neighbors, also engaged and part of the experience of the pandemic and so on, was important to be able to put forth their concepts and their perceptions of the world into this discussion with the state. So I would say that's the example that I would like to bring now. And we can probably speak about that a bit more later. Yeah.
That'd be fabulous. Thank you. And I'm really struck by, for each of you, from your very different organizational starting points, are really foregrounding the importance of community and partnerships and community ownership and community leadership. And again, I'm really struck by the importance of language in this and making sure that this is not an externally imposed language around climate or health, but that this is coming from the communities themselves to help with that ownership. So let me ask you all one other question, which is about the COP30, the UN climate change conference that was held towards the end of last year in Brazil, with nearly 200 countries attending. Obviously, it's a very big deal in the climate world. And these are kind of big questions for the 2 minutes that I'm going to give you to respond, but I'd love you just to each say something about what outcomes from this COP, this Conference of the Parties, stick out to you and your partners, and how useful do you think these COPs, these meetings are for helping to catalyze climate and health solutions in the current moment, given everything that's going on in the world? And this time I'll start with you, Lityana, if that's okay.
Absolutely. Thank you, Laura. So several outcomes from COP30 kind of stuck out for us. Firstly was the Belém Health Action Plan. It sets clear actions to make health systems climate resilient, which I thought was important to highlight. And also the COP30 adoption of the global multilateral decision calling for tripling of adaptation finance by 2035 and the Belém mission for 1.5 degrees Celsius. But we also took note that it failed to mandate a fossil fuel phase out, nor had a firm deforestation roadmap. Many Pacific civil society groups really condemned the weak outcome of this, warning that without stronger commitments on fossil fuels and finance, our frontline communities remain at grave risk. I think also the adoption of a 10-year gender action plan and the launch of the Belém action mechanism signal recognition of gendered impacts and the needs for just transition. Yet both of these also remain constrained by weak financing, voluntary commitments, and uneven political will. For women, girls, gender diverse people, and frontline communities, especially in small island states and the global South context, the adaptation, finance, and ambition gaps persist. The call for triple adaptation finance by 2035 falls short of justice-based demands, with no guarantees of public grant-based funding or accountability for loss and damage. So from a young feminist lens, COP30 advanced frameworks, but failed to shift power. climate justice remains deferred as fossil fuel interests, extractive economies, and patriarchal decision making continue to outweigh care, equity, and survival. Um, in practice, I think COPs remain useful global conveners. They bring visibility to climate health links and kick off initiatives like Brazil's Health Day and Health Action Plan. However, the negotiation processes often still underdeliver on big asks. And in our view, COPs are most valuable for networking and agenda setting. They enable science policy dialogues. They let us spotlight health and health equity and climate justice on the world stage. But real progress also needs to be followed through in national policies and financing outside of the COP venue. Yep.
Thank you, Luciana. That's all very helpful perspectives. Hamza, can I turn to you on this same question about the COP?
Yeah, sure. And I think as Luciana was kind of referring to there, I think we've reached an age now, what we know was that 57 companies account for 80% of global emissions, right? So we're in a system now where I think our extractive nature is completely got us at the brink on a number of fronts. And I think there's a realization at times this year I felt that we are recognizing that we're going to have to adapt, and we're going to have to adapt rapidly to a world that is warming, that is burning, that is in reality affecting the people who have had least to do with the issues, people living in Pacific Islands, people living in places like in Pakistan and other kind of fragile lands now. And I think for us, I think we always lean into that local wisdom and local stakeholders in terms of what does this really mean in the national action frameworks? What does it mean in terms of funding flows? And how do these decisions actually impact the people most affected? I think the key things, I guess, from my perspective, not to kind of repeat what Litiana mentioned on the action plan, was around the 8 kind of global health indicators that were kind of talked about, the 8 health global adaptation indicators that have kind of started to come through within this structural kind of global framework around climate and health solutions. Everything from resilient health systems, early warning systems. We talked about health worker capacity, surveillance of disease, and particularly from a hygiene lens. I think the appreciation of zoonotic disease transfer and what does that actually look like in populations to predict the next pandemic. I think we've all quickly moved on, but I think these are now becoming more and more attuned to the fact that we're going to have to adapt rapidly. So I think for us, looking at our partner networks, and of course we work, in really well with the University of Southern California, the Institute of Global Health Inequalities, leaning on the expertise that you all hold, working with our partners, the social innovators on the ground, the women leading the most important work right now. The thing that was struck us the most and shifted was, I think, that acknowledgement of the intersectionality between the goals. I think the SDGs have been brilliant at galvanizing and giving us a framework, but they've also, I think, also created lanes of funding and very much this disconnected view of finance to address our issues. So I think now what I noticed quite quickly following COP and afterwards has been, actually we can start to think about this intersectional finance. We can stop thinking in verticals, start thinking horizontally. So if we have a climate initiative or a climate financing vehicle, actually that can have multiple goal benefits such as health, education, workforce, responsible consumption and production. So it enables us to start thinking differently about how we invest as a private sector, but it also makes us think differently about how do you actually need to engage with government and in which department do you engage in government. It's not only a ministry of foreign affairs, rural affairs. You actually now start talking to the Minister of Finance or Minister of Health, and you can start having very different conversations that will ultimately lead to public value being created. So there's some of the kind of key outtakes from my side. Thanks.
That's fantastic, Hamza. Thank you. And I think that notion of intersectional finance is really important because we have been so siloed. And I think if that's something that you see as coming out of this, that feels like a real positive step forward. Johanna, can I turn to you also on the question about COP?
Thank you. Well, it was just down the river on the Amazon, Belém, but I didn't really attend the COP. But I think it was, first of all, a great choice by President Lula to set it up there in the Amazon, in a city. Most of the Amazonian peoples actually live in cities, not in the forest, yeah, contrary to what people think. And these cities have many of the issues, not just of climate change, but of disorganized urbanization. So I'm pretty sure that that was part of the setback of what was happening at COP, and probably important for all the leaders there to see. And I think Lula was making a decision there to put the Amazon first in terms of what's happening in climate change. Um, yeah, so that was the first part. While the COP was happening, I remember actually one of the elders, we were having a workshop, and he mentioned it. He said, well, because there were many indigenous peoples traveling, and that's another important point, that it was close by, so that many indigenous, I think the COP that has had the largest participation of indigenous peoples so far. So that was a really important point. And this elder was saying that, well, all these people were meeting up there, all these presidents, all these important people, but it was probably not where the solutions for what was happening was going to were going to emerge, and that it was actually their task, the elders, to keep managing and controlling and protecting the environment. And really that made me think a lot about the different spaces of action and what things like the COP allow to do, and some of that has been already mentioned by Litiana and Hamza, at a high level politics and what happens every day in people's communities and in people's life environments, right? Like not just humans, but taking care of humans and non-humans and the plants and the animals and the environment as such. So I think that's what this elder was saying. I think that was perhaps a good point that I took. Like, yeah, well, all that is happening. Let's continue here doing something that is also contributing to that, and that everybody needs to keep doing that in each of their spaces, and only that is going to really bring a change. Of course, this high level politics is also important, because many of these things of the local activities and yeah, local actions depend sometimes on funding, but also on legal frameworks and on that intersectoral understanding of health, climate, and environment and biodiversity and so on, right? So I think it's also an important space. And I think what's been happening, for example, with indigenous peoples, there are several COPs in which they have attended, and their representation, their way of representing themselves, and the language, we were speaking before of language, the language that they're using in these COPs, even though they're there, they might not be allowed in the negotiations as such. They're not allowed into all the hierarchical spaces in which the important things happen, but their language is there, and they're positioning themselves each time in a different, in a more sophisticated way. So putting forth, for example, a non-anthropocentric view of health and of the climate as such. It's not just because the humans are affected, it's really the humans, the plants, the animals, and all the spirits, and all the people who live in all the beings, the living beings and non-living beings that are part of territory. So I think that shift of language is happening in all of these spaces. And yeah, that's what I think is perhaps important of the COP30, that it really gave a space to a larger participation of indigenous peoples, and putting forth that message of we can call it biocentric, right? Like a biocentric approach to health, but it's really a different understanding of the animacy of the life that imbues all peoples, animals, plants, and how we are connected. So that working on climate has to do with working on health, has to do with working on the education of the young people as well. It's all interlinked. So that discourse, that way of indigenous peoples being present in the stage, I think was important of this COP. Yeah.
Great. Thank you, Jana. And again, like really important about the location of the COP for just for that. I want to stick with you for a bit actually, because I want to pick up on this issue of the importance of indigenous knowledge and action. And just wonder, sort of based on your work with indigenous communities in the Amazon, what do their approaches to health, care, and resilience teach us about responding to climate-related challenges and adaptation? And what do they teach us about partnerships, right? And I just wonder if there are ways that these community insights can and should inform the way that national and global level leaders are implementing their climate health commitments. And what can we learn from these communities kind of in these areas?
Yeah, well, it's precisely what I was saying. So there's a more interconnected, interdependent understanding of health and climate now. We have One Health, planetary health. We've had eco health for a long time already. So it's all becoming more ecosystemic, more connected. And if you speak to indigenous peoples about it, well, they've been doing this in a different way, but they've been doing this for a long time. So it's very common to hear them say things like, well, we're not just protecting the health of humans, of the men and women that live in our village. We're protecting the health of the men and women that live in very far away places, let's say like Europe and other places, but they're also protecting the health and the lives of plants, animals, and so on. So this sense of the interconnection that for them has very different grounds, right? It's not an ecological only, an ecological relatedness understanding only, but really the understanding that these beings, plants, animals, they all have uh, inner lives as much as humans. They're all important beings. They get angry. So you have to manage the relationships. So it's a constant. It's not just about the equilibrium of beings, but it's really about having good relationships, supporting all these beings because they can get angry and cause disease, and you always have to be in the lookout for diseases that happen because you've angered, for example, through mining by taking out of the ground spirits that are buried in the ground. Or you can have relationships of care with plants that are not, it's not just a plant is not just a medicine, it's a being that helps you in the care that becomes a partner to a traditional medical doctor or shaman to heal someone. So these are not, they're not seen as just in ecological terms, but really in terms of how these beings are alive. Um, I think it's not necessary for the rest of the world to I mean to take that vision that everything is animated uh, in order to achieve a change, but to take the vision that we need to relate to all these beings as living as part of a complex ecological system is, I think, going in the right direction. Understanding less health and climate. That's a problem from humans or from an anthropocentric view, but really a problem of a whole setup, a whole relatedness between beings in an ecological system. So a more biocentric approach. As I said, we see this already in the One Health and ecosystem and planetary health approaches, and I think more on that needs to be happening in the future in order to be able to really change our way of perceiving climate actions and health and all of this in a more integrated way. Yeah, yeah, that's what I think I could say about these worlds. It's also understanding that we live in very different planets, really. And it's not just about respecting a different culture, it's about making possible all these planets to continue existing. It's not just about cultural tolerance, but for them it's really about sustaining a possible way of life that will not exist if, let's say, there's no territory because it's being mined, or if climate changes and the Amazon is destroyed. It's not, there's no choice. It's a world that will end. So understanding these multiple worlds in our small planet is also something that I think needs to come from that relationship, for example, with indigenous peoples, from that understanding.
That's really helpful, thank you. And I think this idea of multiple worlds is important, but multiple worlds that are so interconnected that what
Yeah.
we do in one world is having huge impacts in other worlds.
Yes. Mhm.
So moving us on, Hamza, can I turn to you to start us thinking about cross-sector partnerships and the role of the private sector, and really what is needed to build stronger cross-sector partnerships of the types we've been talking about, particularly between private companies, academia, governments, NGOs, and funders? And kind of what do you see as the role of social impact and how impact strategies can meaningfully and usefully contribute to climate and health partnerships? So over to you.
Thanks. Thanks, Laura. I was reflecting on this. I think there are, from my experience, I think there is a fear factor around the sector, around the private sector and partnering, which I think has been there for the right reasons over the years, where I think the sector has often been painted with a single brush that, with the profit motive often overcoming many other important considerations when engaging in partnerships. And I think one of the things, there are a number of factors that I think are important in order to overcome those in terms of success factors. The first is really kind of at organizational level. So I think I would call it deep mission alignment of any partnership across any sector. I think mission alignment is the single most important thing when it comes to partnering deeply. And I think that is really about ensuring that that mission is aligned across the parties and has a very clear glide path to delivering upon its mission. And I think often where we see scope creep or a mission has not been able to be delivered through the partnership is when we see partnerships and cross-sector collaboration fall over. But I think we need to all find ways to stay the course until that mission is resolved. And in many cases, these missions will not be resolved in the lifetime of these partnerships. So what does that longevity look like? The second thing would be the personal, of transparency and trust, as was alluded to earlier. I think it's critical. I think it's ultimately, yes, it's an institutional level alignment, but actually there are humans working in every organization. And I'm pretty sure that nobody really wants to see the world burn in some of these organizations. We all want to see a thriving world for ourselves and the next generations to come. So how do you ensure that there is a shared understanding, a belief, and create a structure that can live without the presence of those individuals creating the partnership? So what does that structure look like? Because often things become individual, things become personalized. Actually, do they have the longevity and the credence to continue after the lifetime of those individuals being in that organization? That is a really important consideration, this institutional, personal dynamic that goes on in any partnership. Third thing would be country level. The importance of country level leadership has never been more important than today. I think you need global architecture to any kind of partnership, or multi-country architecture, or even local architecture, but you need the people on the ground with that nuance to really be driving. They have the wisdom, the local nuance, the lived experience, and really cross-sector collaboration needs to put the lived experience at the center of any partnership. I think there's also the fourth thing I would say beyond the country level leadership is really the technical aspects of any partnership across sectors. So I think, we often think about a nice theory of change and a plan to a partnership. In reality, I think everybody has a plan until they get punched in the mouth, as Mike Tyson once famously said. And in reality, the days of setting a theory of change at the beginning of a partnership and letting it take course are gone. I think we need to be adaptable to geopolitical risk, climate collapse. So how do we make sure that we have an understanding in a partnership that this theory of change needs to rapidly move and prototype with the times, be flexible enough to take those shocks, but also deliver on the outcomes that we promised? And I think that also comes down to the indicators that you mentioned around climate and health. Often where I found tension is that what's a primary, secondary, and tertiary indicator for any partnership? Is climate the number one indicator? Is health? Is it that we're looking at these broader determinants of impact? So I think that the technical aspect of any partnership needs to be really thought through and really clearly labeled. I think also then the financial aspects of the partnership beyond the technicals. So, and I'll talk a little bit about this later, is that, what is the model of financing within the partnership that can live beyond the end of the agreement? It's the hardest thing. How do you make sure that there is a life beyond the 3-year, the 4-year, the 5-year? Because these issues are getting worse, not better. So we need to find mechanisms that might help that. And that comes to my final point, which is, what is that plan for eventual exit and handover? We've been involved in partnerships right now in Thailand and Pakistan around sexual reproductive health and rights. So amazing work being done with the Institute of Health and Inequalities on youth participation within shaping this agenda. The hardest thing to find in any of these relationships is, what is the plan for exit? Who takes accountability at the end? How does it transition to government spaces or to public institutions? And how do local communities actually feel as if they own and lead that initiative beyond the time of the funder? So there's some of the things that are top of mind for me on building out those partnerships. Thank you.
Thank you, Hamza. No, all really useful food for thought, and just a real illustration of the increasing complexity of partnership in the world today, and how we still have a lot to think through. Okay, let me turn to Litiana now, and I'd really like to focus on the role of intergenerational partnerships in climate justice advocacy, and to learn from you, what are some of the effective strategies for ensuring that young advocates and emerging professionals are not simply included in the decision-making process, but they can actually meaningfully influence outcomes, especially in the face of shrinking space for civil society and growing political pushback. So what really is needed to sustain successful intergenerational partnership? And again, if you have any examples from your work, it'd be great if you could draw on those. Thank you.
Sure. Thank you. Well, climate justice and intergenerational solidarity are deeply connected. Climate change is inherently an intergenerational issue. For us, we feel that effective intergenerational partnership means empowering youths as full partners, not just tokens. I guess research underscores that to integrate young perspectives into climate action, we need deliberate and intentional youth-adult collaborations. This is very key for policy impact. In practice, we feel that strategies should include co-leadership models, mentorship programs, and safe enabling environments where youth ideas are respected. An example I can give is the Pacific Youth Council, which connects national youth representatives from each Pacific Island country, and they are paired with senior leaders in Pacific governments for joint climate dialogues. In Fiji, AFG itself co-trains youths with senior experts from health, senior experts from faith-based organizations, senior experts from climate finance, and through our 6-month intensive program called the Youth Climate Ambassadors Program, and we pair them up, and they and there's a mentorship that goes on for those 6 months. I think meaningful influence for us is designed. It has to be intentionally designed and not just accidental. From our field work, I feel like I could list a few specific ingredients, which are shared decision-making roles where youths co-chair working groups or co-author community plans. As I mentioned earlier, mentorship with power sharing, where elders and technical partners mentor and guide, but the youths hold the pen. Having funding and logistics under youth control, for example, having budgets be co-managed with youths, not just put upon youths to work with. And lastly, having safe spaces for political voice that connects village mandates to the national fora. I had mentioned in the beginning our Think Pacific program and the Navalal projects. These illustrate some of these examples where youth-led hazard planning and mapping with their vetiver initiative, vetiver planting, where elders provided the protocols and external partners provided the materials and training. So everyone had a named role and an accountability role. And the results were that youth ownership of outputs that could translate easily into policy. Yeah. So we feel that these partnerships must overcome shrinking civic space by building solidarity. As UN leaders note, youth activism is usually hindered by restricted freedoms and funding costs. So we counter this by forging even broader coalitions, coalitions with feminist organizations such as Diva for Equality, with Pacific NGO coalitions such as the Pacific Island Climate Action Network, Pacific Regional NGO coalitions. So I guess to just summarize this, for us, sustained intergenerational partnership requires trust building, of course, as Hamza highlighted as well, trust building, mutual respect, shared goals, and formal roles for youth instead of just ad hoc inclusions. Thank you.
Great, thank you. So I think what's really coming through is this idea of intentionality from the very beginning, but also this willingness to share power and to say this, we have to be honest about where decisions are being made, and if we really are talking about youth engagement, that it is across the spectrum, including in those decision and budgeting spaces. So that's really helpful. I know that the hour is evaporating, so I'm gonna. There's still a couple of questions I want to get to. I'm going to do a kind of rapid fire round with all of you again, because you're all engaged in collaborations that are key to climate and sustainability. But it's a really complicated moment, right? Climate disasters are rampant, financing mechanisms are nowhere near what they need to be. Neither climate nor many health-related issues are top on the list of priorities for many funders. And obviously, there have been huge changes to the global architecture in the last year, and I suspect there will be many more moving forwards. So, a basic question: what should it look like to be a good partner in this moment? What are some of the bottom lines and some common principles that we can all hold on to now and moving forward? And so let me start. Hamza, can I start with you on this one?
Yeah, sure. I'll keep it brief, just in the interest of time. As you mentioned, Laura, I mean, it's the hardest time that we've had to face, and I think in our history, this is something that a previous generational have not really had to tackle. So for me, there's two really clear taboos that the industry needs to tackle right now, and they're the two F words that I often talk about. The first is being open on funding, and the second is being open on failure. And I think the two go hand in hand. We're in a situation now where everybody is feeling the pinch on funding. We've seen the overseas development aid collapse almost overnight. We've seen a huge bottleneck. So everyone is feeling the gap, but no one's really talking. We're not speaking enough about what that actually means. Communities are being asked to do more with less. Governments are stretched. The private sector and others are being asked to deliver miracles, essentially, on kind of addressing those gaps. I think a good partner right now speaks honestly and openly around funding, and looks at new innovative financing mechanisms, that looks at outcome-based models, looks at building trust-based philanthropy, looks at these new systems of funding that can go beyond the term of a traditional program. So that's one. Quickly on the second is failure. I think we need to be open, and a good partner is open around failure. If we're not failing, we're not experimenting enough, and we're not solving a problem. So I'll end it there. Thanks.
Thank you. I love the boldness of being. Thank you. I like the boldness of being open to failure. Johanna, can I pass on to you next on this one, just in literally like a minute?
Yeah, no, well, I agree with most of what was said before on partnerships, right? Like trust and keeping partnership after the life of projects, the short-lived life of projects and so on. I think something essential is actually to bring care back into the picture, right? Like, I mean, I think that's what indigenous communities, when they're speaking of all these things, that they're caring for the life around them. Part of the trust comes if they feel that we're also caring for each other and we're caring beyond national borders, beyond regions, beyond organizations, and so on. I think somehow having care as a moral path, or something that can organize, direct, shape the ways that we're doing funding, that we're doing organizations, that we're doing policies, and so on, is essential. And it's not yet a big part of public health. It's perhaps more part of feminist care, ethics of care, and so on. But really, to frame care beyond the current global security framework that is actually what is leading climate change and public health. It's not about care, it's about global security. So actually shifting the focus to care, I think, is essential for building better partnerships and for climate and health work.
Fantastic. Thank you. Litiana, over to you very quickly.
Thank you. And yeah, I guess I'll just build on from the economy of care that Joanna spoke on. From the 17 key demands that came out of the Conference of Pacific Feminists Defending the Living Planet, we identified that it was really clear that we need to end greedy neoliberal capitalism and shift to people-led, embodied, intersectional systems with real accountability. And I guess just very quickly, from our grassroots initiatives, working with frontline communities, some non-negotiables for us would be having co-designed and co-managed funding and work plans, where local teams must hold the decision-making rights and budget lines. Also, with capacity and time investments, where partners aren't just parachuting in, that there's a fair allocation of resources for translation, for training, and for follow-up. Also, to have that respect for local protocols, having transparency in funding and direct support for grassroots systems. And lastly, being very sensitive to mental health and cultural loss. That is also a big part of the climate crisis that we're going through. Yeah.
Thank you. And we've got 2 minutes left. I'm going to be really ambitious. I'm going to ask you in one sentence, can you each tell me one positive thought about how to move this work forward? And really in like one sentence. Litiana, let's start with you.
Ooh, I guess high impact, scalable idea is community-led climate health hubs. Um, Giving small grants to village youth groups to run linked projects that protect the ecosystems and health, I think.
Great. Thank you. Johanna, on to you.
Yeah, that's very difficult. But I guess that funding is also felt by people as care and gives autonomy to people, cultural autonomy. So I think, yeah, like funding for small communities, for youth groups, for organizations is essential. That funding is more distributed. I think that's essential for being able to make these initiatives from communities grow, actually. And I think that's it.
Fantastic. Thank you. Hamza.
I would say embrace local wisdom and invest in women-led innovation.
Fantastic. So I love that we could end on some positive notes, some real ways to look forward. Thank you all. You've been a truly amazing panel. I think we've really gotten into the complexity of the moment and the challenges around trying to do this work, but also how critical the work is and how important it is to be learning these lessons and helping to move us forward. So I do hope we can keep these conversations and collaborations going. But for today, let me leave you all with information about our next event. I hope to see you all there. It's actually an in-person event that's happening in February. Thank you all for being here today, and I wish you a wonderful rest of your day.